Good afternoon. I'm Dr. Joss Reimer, Medical Lead for the Vaccine Implementation Task Force. So first, I want to thank all of the Manitobans from rural and northern parts of the province who joined myself, Johanu, Minister Stephenson, and Dr. Roussin at a telephone town hall last night. Almost 28,000 of you joined us, and I'm told that this is the most highly attended telephone town hall of any that the province has held. There were a lot of great questions, and we answered as many as we could. We have another town hall that is set up with Winnipeg residents for tomorrow night, and I encourage anybody in Winnipeg to join if you can. Today, I am pleased to announce that eligibility for those who can be immunized will be expanded further. So as of today, people aged 59 and older and First Nations people aged 39 and older are now eligible to make an appointment to get the vaccine. I want to assure Manitobans that we are also looking very closely at our eligibility criteria right now to determine how we can best protect people at risk of COVID-19. We already know that certain areas of the province are seeing higher case counts and rates of transmission. Je tiens à assurer à la population manitobaine qu'en ce moment, nous examinons aussi de très près nos critères d'admissibilité pour déterminer la meilleure façon de protéger les personnes vulnérables face à la COVID-19. Nous savons déjà que dans certaines régions de la province, le nombre de cas et les taux de transmission ont augmenté. As these adjustments are made, we will continue to update you in bulletins, at events like these, and online. And I hope to share more news about this very soon. I also want to highlight again the eligibility criteria for the AstraZeneca or Covishield vaccine. Since we have distributed over 50,000 doses to medical clinics and pharmacies across the province. This vaccine is for people who are aged 55 to 64 who have a health or medical condition that puts them at more serious risk of severe outcomes from COVID-19. There is a complete list of those prioritized conditions on our website. The AstraZeneca or Covishield vaccine can also be used for anyone who is 65 and older, but we've asked that priority be given to those who may face challenges or barriers in going to a super site or one of our pop-up clinics. Yesterday, the Public Health Agency of Canada received a report of a case in an individual living in Canada who experienced the rare side effect that I've spoken about before of a combination of blood clots and low platelets after immunization with Covishield. Reports of blood clots with low platelets in people vaccinated with AstraZeneca vaccine are still very rare, and this is the only one that we've seen in Canada so far. But this report shows that our vaccine safety monitoring system is working extremely well, because like what we saw in Europe, we're able to find cases of this despite how incredibly rare it is. Based on all of the evidence available internationally to date, we continue to believe that the benefits of AstraZeneca to protect against COVID-19 far outweigh the risks associated with it. This is because the risk of COVID-19 is greater than the risk of blood clots related to this vaccine. We do have a bit more data from the UK on this, which I want to share with you just because it helps to illustrate what the risks really are for people comparing COVID-19 to the AstraZeneca vaccine. The risk of serious harm from this vaccine is at its highest right now, about 1 per 100,000 doses, with that risk becoming smaller as you get older. We've seen higher rates in younger people, but the 1 in 100,000 is the highest rate in any of the estimates we've seen so far. And like I said, it's quite a bit lower for older Manitobans. This is consistent with what I've shared before, but also part of what guides our decision around making eligibility decisions for AstraZeneca and why we excluded younger people in our pause. The risk-benefit ratio for AstraZeneca wasn't clearly better compared to the risk of COVID-19 for people who are younger. But among older people, even those with a very low risk of being exposed to COVID, we still saw a great improvement in the benefit of being immunized compared to COVID-19. So in that older population, people aged 60 to 69, the AstraZeneca vaccine brings a risk of serious harm that's somewhere around 2 times out of 1,000,000 doses, or 0.2 out of 100,000. However, even amongst people who are low risk of being exposed to COVID, the UK still estimates that the AstraZeneca vaccine would prevent 141 ICU admissions for every 1,000,000 doses. So we're talking about 2 people out of those 1,000,000 doses who are at risk of the blood clot, but preventing 141 ICU admissions. If you're age 60 to 69 and you have a high risk of exposure, the benefits are even greater, because the AstraZeneca in that high risk scenario, according to the UK data, would tell us that over 1,000 ICU admissions can be prevented in those 1,000,000 doses. We know how devastating an ICU admission can be on people as they fight to recover from the virus, how hard it is on their families, the people who work in our healthcare system, and on the capacity of the system overall to respond to other health conditions. And so I bring this information today because I want you to know that we don't take these medical recommendations about vaccines and who should receive them lightly. If you are currently eligible to be immunized, I would encourage you to make an appointment and get your vaccine as soon as possible, whichever vaccine you are eligible for. As I was saying with the numbers, the benefit of this vaccine far outweigh the risks associated with the vaccine for the groups that are currently eligible. Si vous êtes actuellement en droit d'être vacciné, je vous invite à prendre rendez-vous et à vous faire immuniser dès que possible, quel que soit le vaccin actuel auquel vous êtes admissible. I want us all to get vaccinated in order to protect the most vulnerable folks in our community during COVID. I also want to briefly address some questions that we received this week from people who were concerned about the weather-related cancellations and meaning that doses were going to waste. So the short answer to the question of wasted doses is that no, doses were not wasted related to weather cancellations. The immunization teams all know how to prepare the vaccine to minimize waste in any situation. We carefully monitor throughout the day so that the team can adjust. If people can't make their appointments, less of the vaccine is thawed and less of it is prepared for use. We've also had some questions about how people can get infected with COVID-19 after receiving the vaccine. It does take time for the vaccine to produce an immune response. The immune response, so the body producing those antibodies that can recognize and fight the virus, takes about 2 weeks to build up after a dose of the vaccine. So any infection that occurs during the first 2 weeks after you receive a dose of a vaccine was either contracted before the dose was given or before the body had that time to mount an immune response. And now, while we know that the vaccines are very effective at reducing rates of infection and slowing transmission of the virus, particularly after those 14 days, nothing is 100% effective. This is why we still encourage people to continue to follow the fundamentals, stay home if sick, reduce their number of close contacts, wear a mask with others from outside their household. And the data shows us that after people have had an immune response, the vaccine shows significant benefits in reducing the chance of infection and in reducing the serious side effects of the virus. We have seen some shifts where our older populations appear to be having lower rates of infection now that many of them have been immunized. So please book your appointment as soon as you are eligible. Before we close, I just want to reiterate that we are in the beginning of a third wave in Manitoba. Your actions right now are critical in order to protect yourself, protect your community, and to avoid further restrictions in the near future. We must continue to be vigilant. So get vaccinated when you're eligible, keep wearing your mask, limit your contacts, follow the public health guidelines, and follow the fundamentals. Nous devons demeurer vigilants. Alors, faites-vous vacciner lorsque vous êtes admissible. Continuez de porter le masque et de limiter vos contacts conformément aux directives de la santé publique et observez les gestes de base. With that, I will turn it over to Johanu.
Good afternoon, everyone, and thank you, Dr. Reimer. I'm Johanu Botha, Operations, Logistics, and Planning Lead of the Vaccine Implementation Task Force, and happy to be here with you today. More Manitobans are being immunized every day, and that is great news. As of today, we have 299,821 doses that have been administered to Manitobans. And earlier this week, we hit another milestone. More than 20% of Manitobans 18 and older received one dose of the vaccine. As of today, that figure sits at 21.5%. This is great news for Manitobans. Today, we expect to give more than 6,100 doses, which does not even include the amount that will be administered by our partners today, and will be completely out of the task force's vaccine supply unless more shipments arrive within 10 days. I want to be clear that each and every one of the doses that have arrived in Manitoba is spoken for. In addition to the doses that are now already in arms and protecting the people around us, we have also delivered doses to our First Nation partners for their immunization campaign, and of course to medical clinics and pharmacies as well. All of the other doses are used in super sites, pop-up sites, and by our focused immunization teams, and are not with us long. We know that Manitobans are rightfully setting a high bar for us, and we want to keep building your confidence in this campaign. So today I'm pleased to announce that our next super site will open in Steinbach in May as the vaccine supply further increases and stabilizes. The site will be at 294 Lombard Avenue in Steinbach. We are continuing to evaluate what we do to make our processes as efficient and effective, but as safe as possible. As I talked about last week, we improved and clarified our data so that all Manitobans can see in our online dashboard how many people we immunize, what is in our inventory, what we control as the province, and what is being delivered by our partners. That data shows we're getting within days of zero stock each week. Work is underway this week to put a more responsive ordering process in place for our distributed channel, which is our partnership with medical clinics and pharmacies. This will ensure more doses go to locations that are able to quickly deliver them so we can respond to the needs of those communities. We will also work with these partners to ensure data entry is happening as quickly as possible so that the data overall can more accurately reflect the pace of the overall vaccine delivery rollout across Manitoba. We have talked before about the various ways we get vaccines to eligible people throughout our province, recognizing super sites are the fastest, and other methods take more time, but offer more reach. For the immediate future, I would like to flag that we may have to balance a bit more towards speed. So this means we will be adjusting the use of pop-up clinics so that we use them mainly in locations where they are necessary, where there is a significant barrier for the majority of people to get to the nearest super site, or perhaps in areas of higher spread where a larger pop-up needs to take what would have gone through many smaller ones at a slow rate to get many doses into arms faster. We'll be finalizing that approach in the days ahead, but I think it is fair to say that Manitobans can, for the short term, expect fewer but faster options. Once we have more supply and we have been able to immunize a larger portion of people, we can return to more pop-ups to ensure broader convenience across the province. Finally, we are refining our planning assumptions about when vaccine deliveries arrive in the province, specifically the ones that we use to feed our super sites. We've been operating with a very small margin of doses carrying over from the end of 1 week into the next in case a shipment of Pfizer vaccine is delayed. But the Pfizer supplies seems to have stabilized, and so tightening that margin, even to add a small bump to our doses administered in the short term, will also help maximize the number of doses we administer from shipments every week. Together as a whole, these actions will help us get needles into arms as quickly but as safely as possible. As I've said before, nothing is off the table in how we plan and how we roll out our vaccine. We expect to refine and add other approaches based on medical direction from Dr. Reimer and her team, of course, and we'll keep you updated as that work progresses. With that, over to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. Dr. Reimer, as you said before, it's a race between the vaccines and variants of concern, but right now vaccines are losing this race. What can we expect now that we are seeing a third wave?
I mean, I think the team is trying to reach Manitobans as quickly as we possibly can. We've heard Johanu talk about the larger pipes that we have and our ability to move vaccine incredibly quickly through those pipes. While it is slower, but still essential that we use some of our smaller pipes to reach more vulnerable folks because of either their geography, their health, their location. And so we need to be looking right now at the data to analyze where those highest risk areas are and targeting our vaccine rollout to reach the highest risk areas as quickly as possible. And indeed, our team is working on that and fine-tuning the details as we speak.
And yesterday, Mayor Bowman called for vaccinations for essential workers, first responders, and the homeless population. These are all groups of people who tend to skew younger. How are these kinds of populations being considered when it comes to vaccines and the vaccine rollout?
So we do have a table that's been meeting with a variety of organizations that serve people who are experiencing homelessness. And so that work is ongoing, and we are planning some pop-ups that will be available for those populations specifically. As far as essential workers, that's exactly what we're looking at right now, and our team of experts is trying to fine-tune to figure out amongst workers, amongst people according to where they live, who really is at highest risk, because the numbers are shifting. We're just starting in our third wave, so we don't have a lot of information that is specific to Manitoba yet. But the team of epidemiologists and physicians and nurses is working very hard to use the information that we do have to fine-tune the plan for how we can best reach the folks who really are at highest risk now that everybody over 60, well, over 59 in Manitoba is eligible.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Reimer. Just following up on that, what has the province's jurisdictional scan revealed about the impact of the third wave in other provinces, and what decisions have you made about changing vaccine eligibility in response?
Yeah, so I don't have any final assessment that I can release today, but the team is working on the final details and the discussions are ongoing, and I'm optimistic that we'll have something very soon that we can share with Manitobans so that they can see not only who's at highest risk, because we want to communicate that, but also how we plan to reach those individuals.
Okay, thanks. And the province has provided me some details about COVID infection post-immunization. And so as of April 9th, there were 111 people who were infected more than 14 days after their first dose, and that included 9 hospitalizations. Are there any trends in who is getting sick after immunization, and how does the rate of hospital admission after vaccination align with your expectations?
Yeah, so because there's only been 9 hospitalizations in people who were diagnosed with the infection more than 14 days after a vaccine, it's pretty impossible for us to recognize a trend when it's so few people. We were encouraged, though, that out of the hundreds of thousands of people who have received vaccines, that we still have only seen 111 cases of COVID showing up after the vaccine. Which works out to I think it's if I look at my notes, I think it's about 0.06%, so incredibly low. So we actually are quite reassured that the vaccines are very effective. But like I've said, they're not 100%. We know that no vaccines are 100% effective, and so it is critical that while we're still trying to get more doses in, we have not reached herd immunity. And so it's important that people follow the fundamentals while we continue to get more people immune. Because once we have enough people in the community vaccinated, we start to protect each other. And so even for those folks who the vaccine didn't protect them from the virus, if there's no virus circulating, they're still protected. So right now, the message is still, wear a mask, stay home when you're sick, reduce your contacts as much as possible. But the whole goal of our program is to decrease the amount of people who can carry the virus so that we can all start to move back to a new normal.
From Global News, Brittany.
Hi, good afternoon. Brittany from Global. Johanu, we talked a little bit about this at the technical briefing, but I'm just wondering if you could speak a little bit more about the specific number of doses that have been wasted, what is an acceptable amount, and also maybe what some of the top reasons were for the wasted doses.
Thanks, Brittany. Some of that is a clinical answer, so I'll pivot to Dr. Reimer shortly. But what I can note is the process that we have set up at our super sites is really to drive down any wastage rates incredibly low. So we essentially only take out doses to thaw once we have people on site, and then we administer it to those who have arrived. So we are seeing an incredibly low wastage rate compared to previous immunization campaigns. But I think I'll turn to Dr. Reimer on why that is.
Yeah, we've done a lot of work with the team to make sure that we're reducing wastage to the lowest amount possible. But we also want to be very careful that we are not discouraging anybody on the team from letting us know when a dose should be wasted. So if somebody has contaminated a needle, for example, we don't want any of our immunizers to feel like they're going to be punished or looked down on because they had to waste that dose. So it is a fine balance between encouraging the team to do everything possible to reduce wastage, but also maintaining a safe campaign. A campaign that had zero wastage is not a safe campaign. And that's essential for us, that above all, what we're doing is trying to keep Manitobans safe. And we don't want the vaccine to ever contribute to anything unsafe for Manitobans. But we've been really impressed so far with how low the wastage rates have been. There's, some of them may be because there's doses left in a vial at the end of the day. Some of them are because there's a contamination. Some of them are because the vial may have looked cloudy or not right. And all of those together have still kept us at about 0.75%, which compared to a usual campaign is incredibly low. So we're very happy to see that we've stayed below 1% wastage, because what it means then is that Manitobans aren't having to wait, more than a few extra hours before getting the dose because of wastage. And so we're really encouraged by what the team's been doing so far.
Thank you. And I just want to touch a little bit on staffing. We know that when there were the big backups at the super site, part of that had been scheduling problems with staffing to get immunizers shifted and having them show up. What has changed in the system to make sure those problems don't arise in the future, specifically too when we're going to be looking at opening more sites and pop-ups in Winnipeg? We'll need to ensure strong staffing plans.
Yeah, absolutely will. So, and thanks for that question. On the scheduling side, what's really helped us is not, scheduling longer in advance, so staff know exactly when they can work, not just tomorrow or this week, but weeks out. What's also really helped is that navigator role, as you may remember, was a high level of casual staff. We have since then offered around 200 term positions, which again allows the scheduling to become more regularized as opposed to just a large call out to a large number of casual staff who may or may not decide to pick up, a shift that's showing up today or tomorrow. So between those two pivots, we've really supported or buttressed our navigator role. And then on the immunizer side, we're moving to be able to bring more students on board. Students of various backgrounds can immunize. There's a recruitment drive going on. And certainly once these students are through their exam season, which I believe is sort of in a couple of weeks, they have the summer to join and support the task force full-time for those who have signed up. So between those and sort of our ongoing recruitment efforts, I think we're in fairly good shape.
From the Brandon Sun, Kim.
Good afternoon. My question is, with the vaccine delivery being a challenge, I'm just wondering if there's any concern of the second dose delivery and the time frame that could be potentially extended due to the supply that is available. Thank you.
I could take that one. So I wouldn't say that our vaccine delivery overall is a challenge. We're still well within the two scenarios that we've painted for Manitobans for a number of weeks now. Ideal case scenario, end of May, and then a less ideal scenario, end June, for all Manitobans all eligible Manitobans having the choice to receive a vaccine. As we mentioned earlier in the press conference, if we don't receive any other doses, then through our super sites and our pop-up clinics and our focused immunization teams, we will be out of doses that we have control over within 10 days. And as of this morning, we have almost 300,000 doses into arms. So I think we're humming along at a good clip. We're looking at ways to go in faster, as I had mentioned earlier. So the moment we've gone through all eligible Manitobans, which again we expect to happen between mid-end May and mid-end June. At that point, given direction from the medical team, we'll be able to move over to second doses.
From CJOB, Skylar.
Hi, thanks for your time, you two. Really appreciate it. Skylar from CJOB. Just wondering if you could explain to folks out there who have received that first shot but not that second, how while they are partially protected, they're not fully protected. We do know a lot of people are, maybe loosening some of their personal guidelines, visiting people they may not have before getting that first shot, but it still could increase their risk of contracting the disease.
Yeah, so the way immune response works is a bit unpredictable from person to person. So when we say that it's 70 or 80% effective, we're looking at how well it works at a population level. So we're not saying that one individual is 80% protected. We're really saying more that overall at the population level, we're seeing 80% of infections being prevented. So what the first dose does for most people is it does give you that full level of protection against at least against severe disease is what we're seeing from the literature. So if you were to be infected, certainly we don't expect most of those people to end up in hospital or to die because of COVID. The first dose also is protective for many individuals to not get infected at all. But the tricky part is that you don't know if you're the person that it worked on or not. The second dose for most people is about lengthening the time that they're immune. But for some of those people who didn't respond after dose 1, and we never know who those people are, they will respond after dose 2. And so there is some additional protection after dose 2 for the people who just didn't have that response. And then there's a third group who even after dose 2 will not have a good immune response and will never be immune to COVID. And because we never know which person is which, that's why we're telling people to continue to follow the fundamentals after dose 1, even after dose 2, until we have enough people immunized that the virus can't spread in our communities. Most people will be protected after dose 1, but you don't know if you're one of those unlucky people who didn't get that full immune response. So dose 2, for the vast majority, our goal is to lengthen how long the immune response stays strong, but there will be a small subset of people where that second dose is what triggers a good immune response. So whether you've had 1 or 2 doses, until we've had the majority of Manitobans immunized, continue to wear a mask, stay home when you're sick, and reduce your contacts as much as possible.
Thank you very much for that. I guess the second question is, we've heard from some pharmacists who still have lots of doses of the AstraZeneca shot, but with the restrictions from Health Canada, which were lifted a little bit today, they're having a hard time getting rid of them. What do you say to that? Is there a way that Manitoba could expand things when it comes to that particular shot to maybe get them into arms faster?
Yeah, so there's 2 separate national bodies that look at how we use AstraZeneca. Health Canada sets up the strict rules for what we are absolutely allowed to do. And then the National Advisory Committee on Immunization creates the guidance on how we should use the vaccine. So Health Canada has always allowed us to use it in 18 plus, but the National Advisory Committee on Immunization advised us to hold on people under 55 until we had more information. So Health Canada has now changed the product monograph, so the information that comes along with the vaccine, to indicate that the cases of blood clots with low platelets are extremely rare, but could be due to the vaccine, but that they continue to allow its use in all adults. The National Advisory Committee on Immunization is going to be meeting to reassess the information. I mentioned some of it that has come in from the UK. And so I'm hopeful we'll get some updated guidance from them soon. And certainly, if what we're seeing in the UK is consistent with the data that NACI evaluates, I'm optimistic that we'll be able to be more flexible in who we can offer AstraZeneca to in the future. But right now we're waiting for that updated guidance from NACI.
From the Winnipeg Sun, James.
Yeah, good afternoon, Dr. Reimer. How many Manitobans have received the AstraZeneca vaccine, and what are the physiological mechanisms involved in the formation of these rare blood clots?
So about 22,000 Manitobans have received a dose of AstraZeneca. And so we haven't seen any cases of this blood clot with low platelet syndrome in Manitoba. But at a rate of 2 per million, we also wouldn't have expected to see any in Manitoba based on the number of doses we've had. So there's a lot we know about this unique syndrome and a lot that we don't know. So what we've been told by the scientists in Germany that were evaluating it is that there seems to be an antibody that is formed that is causing some alteration in how platelets function. So it's actually attaching itself to a platelet factor that both causes clumping of platelets and destroys some of the platelets. So what that does is it decreases the number of platelets that are flowing in the blood, but also creates blood clots at the same time. And so this is quite different than any other type of blood clot formation. So I do want to reassure people who might be at higher risk of blood clots for a variety of reasons that they are not at higher risk of this vaccine-related blood clot. It's a completely different mechanism that has to do with the immune response that the body produces to AstraZeneca. I also want to again reiterate that it's a very low risk situation. And the risk gets lower in older people. So for some reason, it does seem that younger people are more likely to have this strange immune response. So for those who are over 55, the ability for that vaccine to prevent hospitalization, prevent ICU admission, and prevent death is far, far greater than any possible risk associated with the vaccine and the blood clots. So for people who have access to AstraZeneca, I strongly encourage you to be immunized, and I'm hopeful that we will be able to reduce the health condition requirements and maybe even reduce the age eligibility for AstraZeneca, depending on what we hear from the National Advisory Committee on Immunization.
Thanks for that. Are there any other vaccines exhibiting these characteristics?
So there have been some reports out of the U.S. Regarding the Johnson & Johnson vaccine. The trial had one case of a similar blood clot, and more recently, the country as a whole is reporting some cases. We haven't had a chance to meet with the U.S. officials to get a clear rundown of how frequent this is, on who is being impacted. And so right now we only have the basic information that you've seen in the media, but we will be connecting with them. I know the FDA is planning to have some ongoing announcements about what they're seeing and what they're recommending. And so we will connect with them, and we'll work with our federal counterparts to make decisions about how we would use that vaccine here once it's available to us.
Much appreciated. Thank you.
From CBC Radio Canada, Sophie.
Hi, the number of people in ICU is pretty high today. We talk about 37 people. Are you worried about it?
I mean, I think we're always worried about people in ICU, and we certainly don't want to see any Manitobans end up in the ICU because of COVID or any other reason for that matter. Our numbers are going up. We're starting our third wave in Manitoba, and largely because we've immunized our older populations, we're seeing cases in younger populations. But absolutely, we're concerned about the third wave, and so you'll hear from Dr. Roussin urging people to follow the fundamentals, and our team feels the urgency of it from the vaccine front quite acutely. And so that's why we have that team of physicians, nurses, epidemiologists who are right now fine-tuning the recommendations for vaccine rollout, because it is critical that we look at the early data in our wave 3 and try to identify as quickly as possible where we're seeing the virus moving through the province, because not everywhere in the province is experiencing the same level of risk. And so once we've had that chance to get the recommendations from that table of experts, our vaccine team, as Johanu has indicated, is ready to pivot and to make the vaccine available to whomever is at highest risk.
Thank you.
From CBC Manitoba, Bart.
Hi there, Dr. Reimer. Okay, so roughly 22,000 of the 84,000 AstraZeneca doses have been administered so far. There's widespread confusion among who is eligible given the changes, as you can understand with the public. We're also hearing anecdotal reports of some pharmacies that can't get rid of what they've got right now, and they're actively calling up anyone older than 55 or older to say, hey, how would you like a shot? Because they do have that discretion. So why not right now, just even before the National Advisory Committee, simply make AstraZeneca available to anyone 55 and older?
Yeah, that's a great question, Bart. I think one of the big things that is stopping us from moving right now is exactly what you mentioned, that there is already confusion about who is eligible because we have changed it. And so we know that the National Advisory Committee on Immunization is planning very soon to come up with their recommendations. And so because it's coming so soon, we really want to work together with them to have one approach rather than change it today and then, if they come out with a recommendation on Monday, having to change again on Monday. That's just an example. I don't know if they'll be coming out with a recommendation on Monday. So in our goal is to try to communicate as effectively as possible with Manitobans while also reaching people as quickly as possible. I think that a lot of the low numbers that we're seeing in our distributed channel come from a variety of different things. We know that there's delays in data entry from that channel, and the physicians and pharmacists actually do data entry differently from each other. And so, some of that is just a delay that we do expect that once all of that is caught up, higher numbers will show up. But the second is that those channels are slower for good reason. They need to continue to do their regular work at the same time as doing this rollout. For my own clinic, for example, I do prenatal care. And while we are no longer including pregnant patients in our eligibility, we were prior to the change. And so I can't stop seeing people to do their usual pregnancy assessments in order to run a full-time clinic. It's critical that they're still able to come into my clinic to have their blood pressure checked, to monitor whatever conditions they have. But I would, if they were eligible, be offering the vaccine at those visits. And so it does take more time when you're offering your clinical service at the same time as this additional vaccine. Now, some of the larger clinics are able to run vaccine clinics that are dedicated, and certainly all of the physicians and pharmacists that we've talked to are eagerly adding additional appointments on top of their usual work to make sure they're getting the rollout as fast as possible. But we also don't want to take away from the other critical work that they do. So I think there's many things leading to the low numbers there. And this is a really essential location for vaccines to be so that people can get that one-on-one health assessment. But as soon as we hear from NACI, and we hope that it's soon, we are looking forward to increasing eligibility if that's what they recommend.
Thank you very much for that. Mr. Botha, can you just go over, like what you said this morning, that we'll likely see a pop-up clinic in Winnipeg the week of April 19th for medical reasons? Can you go over that?
Yeah, absolutely. So the signal that we want to give to Manitobans is as the medical team monitors the epidemiology during this third wave, the operations and planning side wants to be ready to pivot if we've given the direction that we are going to emphasize our bigger pipes more. So we want to be able to say that we might have fewer pop-ups that take longer to deploy across the province in more remote areas. Certainly not a pause or a cancellation of all of them, but fewer of them as they can take longer to deploy. They can take fewer vaccine with them. And then instead funnel that into a larger Winnipeg style or urban style pop-up. That will allow us to get doses into arms faster. We're already at a very good clip in terms of the super sites and the Pfizer. Our Moderna, I think, as I've communicated before, by design moves slower because the amount of pop-ups and focused immunization teams that we have out there and that we plan for across a longer period of time. So once we get that final direction, and with comfort on the medical side, then we will likely see a larger pop-up in Winnipeg that can go through a large amount of Moderna, within a week as opposed to spreading it over many weeks. I still expect to see pop-ups in the regions next week. I just likely fewer, and so it's fair to signal to Manitobans that there will be fewer small pipes in the short term, quite likely.
From the Canadian Press, Steve.
Hi there. You mentioned the higher volumes that can be done at some of the larger medical clinics. Is there any thought to allotting other types of vaccines to those clinics, some of the Moderna or Pfizer, to sort of speed up that channel?
The operational side, the distributed channels, so the medical clinics that can move faster than some of maybe their smaller counterparts, still cannot move as fast as our super sites, and arguably can't move as fast as a large pop-up that's focused purely on doing vaccine administration for an entire day. As Dr. Reimer was mentioning, our partners within the distributed model are delivering other healthcare services during the day, and they are not dedicated to it the way that a super site or even a pop-up will be. So if our goal is in the short term to really emphasize bigger pipes or speed over remote access, then funneling Pfizer obviously goes to our super sites anyways, but funneling Moderna into larger pop-ups or even having a plan ready for them to go through super sites is the way to go, and not at this time send them through the distributed channel model.
And has there any thought been given to the idea that we've seen in some other provinces of having different minimum age eligibilities in so-called hot zones, having a lower age available, more doses going into areas where the case numbers are very high?
Yeah, thanks for that question. So that's exactly the kind of things that we're looking at right now, and that's what the team of experts is reviewing. We have seen in Wave 2 and are starting to see in Wave 3 as well that certain parts of the province, certain geographic areas are at higher risk of transmission generally and at higher risk of the severe outcomes. So we are asking that team to come up with a plan for how we best reach the people at highest risk, and they are working out the details of that, as we speak. They're meeting regularly to figure out who and where we are seeing transmission, so that we can come back to you, to Manitobans, with our plan for, on top of doing age eligibility, how else we can reach Manitobans who are at highest risk. So they haven't finalized their plan, and I don't have any details to share today, but I'm optimistic that we'll be able to have something in the very near future. That may change again, because we do want to always be responding to what we're seeing in the epidemiology. So what the team tells us, over the coming week, is the way that we want to move. And then if several weeks from now we see something else unexpected in the epidemiology, we might move again.
From CTV Winnipeg, Michelle.
Hi, Johanu's saying that there's a good likelihood that we're going to move away from the smaller pop-up, and it's based on the medical direction. Can you just talk a little bit about what that medical direction is? Why are we moving away from the smaller pop-up?
Yeah, so like I said, we haven't finalized the details yet of exactly who and where we want to be targeting vaccine. We've asked the team to look beyond the age-based approach to figure out, if there's specific locations, if there's specific populations, if there's specific worker types that we need to be including urgently based on what we're seeing in Wave 3. And so in order to do that, we'll need to be able to put the doses in places that those populations can reach. And so while we haven't finalized exactly what that means, we do know that it might mean in some areas of the province where we're not seeing the virus, shifting the doses that would have gone to pop-ups there to a different part of the province where we are seeing the virus moving around. And that can be very frustrating for Manitobans, particularly those who live further away from super sites. We've we've certainly heard from Manitobans the importance of having locations near them. But we're trying to do the best we can with the doses that we have to hopefully reduce the height of wave 3 and likewise reduce the amount of public health restrictions that we have. So if we are moving pop-ups away from people, it's truly because we're trying to lessen the public health restrictions that they'll have to experience while they're waiting for their turn to get the vaccine. So we do look forward to hearing from our experts with a detailed plan. And I look forward to being able to let Manitobans know what that plan is.
Thank you. I'm also wondering about how or what you're looking for that would make a certain region or a certain location higher risk. Would it be, many cases in so many days, test positivity rate in a smaller region? What are you looking for?
Yeah, so that's actually one of the questions that we've asked this same team of experts to put together is some form of an index or indicator of how these groups would be identified. So looking at a lot of different things, but if we're talking about geography, we would be looking at things like rates during wave 2, rates during wave 3, test positivity, the rates of the severe health outcomes. We may also look at other factors that make different groups more vulnerable, like income, for example, or access to health services. So there's a lot of potential indicators that could go into a decision to include a specific population, a specific worker group, or a specific geography. And that's exactly what the team is looking at right now to see which of those indicators is most predictive of being able to prevent ongoing transmission and help decrease the size of wave 3.
Our final reporter this afternoon from City News, Jonas.
Good afternoon, folks. Dr. Reimer, you've mentioned this team that's going to be working on the plans moving forward. I guess, who is this? And I guess, who should folks know is working on these plans?
Yeah, so I mean, this is a lot of the same people who have been working in the COVID pandemic throughout the last year. So, we have medical officers of health who work in public health all the time, who are leading this work. We have some of our epidemiologists on the team. We have some of the logistics experts from the vaccine task force playing a role in the team, and some of our data analysts as well. And the team will also bring in folks as needed to get their expertise on a variety of different areas. We've also taken the same question to our medical advisory table, which is a group of at least 30, I've lost count at this point, but over 30 physicians, nurses, and pharmacists from a large range of specialties such as infectious diseases, family medicine, immunology, and that group as well is being asked to consider the individual health implications of different ideas that come from this table of experts. So the table will continue to work hard, and I have a lot of faith in their expertise.
Thank you very much for that. Mr. Botha, I just want to touch base on, I guess, the doses in freezers today. Just maybe a rundown of what's on hand, what's been allocated with some hard numbers, if you don't mind.
Yeah, absolutely. So the three buckets, so to speak, that we always talk about are the doses administered, the ones in arms, our favorite kind, and that's just under 300,000 today that's been entered. And then we have just under 100,000 doses that's delivered to partners, whether they be First Nations or doctors or pharmacists, and there'll be a combination of Moderna and AstraZeneca, of course. And then there are just under 60,000 doses moving through the channels that sort of are directly under the task forces sort of control. This is the super sites and the pop-ups and the focused immunization teams. I note that you used the phrase doses in freezers. They're not sitting in a freezer. They're moving through the system, and they will be completely out of the system and into an arm within 10 days. That just under 60,000. I should note too that there's been sort of a lot of questions today around the epidemiological analysis that's being done by Dr. Reimer medical team and that planning group on how eligibility might be more refined. None of that is halting our vaccine rollout. We shouldn't have the idea that we're somehow waiting until we get direction and then we move somewhere. Whether we continue with our current pace, which is already quite fast, as I said, we'll be out within 10 days, whether we use a bigger pipe in Winnipeg as a pop-up next week, whether we're able to find ways to use our pop-ups even faster next week, which I expect will probably also be the case given the good work that we do with the regional health authorities. Our system is moving. We will adjust according to the eligibility criteria as it adjusts, but we're not sitting or pausing on doses until something there is refined. Those are in some ways two separate processes. We get doses out as fast and safely as we can, and then we adjust as we do that if the eligibility assessment changes. So sorry, a bit of a long-winded answer there, Jonas, but I thought I'd want to give you the full picture.
Thanks, everyone. This concludes our media briefing.